Wisdom, and I'm the TMS coordinator here at Community Counseling Center. Today on Mental Health Minutes, we will be discussing mental health stigmas. I have Dr. Sidharth Chandra, who is our medical director here at Community Counseling Center, and he will be discussing what mental health stigmas are.
Hello, everyone.
So what is mental health stigmas to you?
So mental health stigmas are any kind of negative connotation or perception in regards to mental health. And it's actually very prevalent across the country and especially in the Midwest. And what that really means is that people think that mental health conditions are a bad thing. There's a lot of negative perception about it. People think, oh, well, I think about what people saw on TV. They're like, oh, well, but that's not actually accurate. Mental health conditions are pretty prevalent across the country, and it's estimated that about 1 in 5 people has a diagnosable mental health condition. Does that mean they need medication? No, but it's common. It's just some area of dysfunction in your mind. And, a lot of people overlook the mind and mental health because it's not something you can physically see. If I break my arm, you can see that my arm is broken. You're like, oh, your arm's broken. That's a problem. But when you have a mental health issue or a mental health condition like depression or anxiety, it's not something that's outwardly visible. I could be freaking out inside right now and you would never know. If that prevents me from functioning and living my life and taking care of my family, then that's a problem. And that's something that there's an entire field of medicine dedicated to addressing so people can have a good quality of life. And mental health is super important because your brain and your mind control every aspect of your life. If you break your leg, you can't drive, you can't go anywhere, but you can still function. If you have a very severe depression, you can't even get out of bed. You're gonna feed yourself or take care of your family or go to work, pay your bills. It's impossible. So it can be very difficult. So that's why mental health is very important. And a lot of this negative perception is because everybody thinks, oh, well, I don't have this problem, someone else does. And you think less of people for that. But as I've said earlier, mental health conditions are very common. And I think people would be surprised if they actually talk more about them, of how common they are. And a lot of improvement in mental health conditions can be from destigmatizing things like depression, anxiety, and things like that, and even severe mental illnesses and mental health conditions like schizophrenia. People have this perception that, oh, it's like what I saw in a movie or what I saw on TV. But I'll tell you that I have patients who I see who suffer from schizophrenia on the appropriate treatment, and you'd never know. We meet each other every day and we talk on the street and they live their lives. The only way they would know is they're like, oh, well, I have this diagnosis in my history, but that's literally the extent of it.
Okay, so what are some ways to deal with mental health stigmas?
So some common ways to deal with mental health stigmas is to just be more open about things and just talk about it. A lot of the stigmas exist because no one talks about mental health. If you have diabetes, everybody talks about diabetes. Everybody knows what diabetes is, whether you have it or not. But that's because we've had an open conversation about it and everybody talks about it. But with things like depression, anxiety, everybody keeps it secretive, or it's very secretive. And so since nobody talks about it, no one knows what is it really like. And a lot of people suffer in silos of silence. I'm feeling down about something, or I am having pathologic depression and I'm not, everything's going fine in my life, but I'm super sad. But if I talk to somebody about it, I might find that you feel the same way. And the more people talk about it, the more you can rationalize it, oh, I'm not alone in this. And that's a good feeling, not feeling that the way you feel is not, you're not the only one that feels a certain way. And that helps that allows us to get care more easily. If you don't feel ashamed about having an illness, then you can go get treated for it and get better.